Noonan syndrome is a genetic disorder. It affects many parts of the body. This means it is a multi-system disorder. It's present at birth, making it congenital. Noonan syndrome is caused by a change called a mutation in certain genes. These genes normally control how cells grow and develop. The condition is named after Dr. Jacqueline Noonan. She was a pediatric cardiologist. She first described the syndrome in 1963. Noonan syndrome is more common than you might think. About 1 in 1,000 to 2,500 babies are born with it. Noonan syndrome affects boys and girls equally. The condition can be mild or severe. This variability is why early diagnosis and individualized care are so important. Knowing the signs and seeking appropriate medical attention can make a big difference in the lives of those living with Noonan syndrome. In the next section, we will delve deeper into the genetic basis of Noonan syndrome. As we've learned, Noonan syndrome is rooted in our genes. Genes are like instruction manuals for our bodies. They tell our cells how to grow and work. In Noonan syndrome, there's a typo in one of these instruction manuals. This typo is called a gene mutation. It disrupts the normal signals that control cell growth and development. It's like having a glitch in the software that runs our bodies. There are several genes associated with Noonan syndrome. The most common one is called PTPN11. Other genes include SOS1, RAF1, and RIT1. Each of these genes plays a role in a pathway called the RAS-MAPK pathway. Think of the RAS-MAPK pathway like a chain reaction. Each gene is like a link in the chain, sending signals that tell cells to grow and divide. When a mutation occurs, it's like one of the links is broken or misaligned. This disruption can lead to the various features of Noonan syndrome. Noonan syndrome presents with a wide range of features. Some are noticeable at birth, while others may not become apparent until later in childhood. One of the most common features is distinctive facial features. These include wide-set eyes, droopy eyelids, and low-set, posteriorly rotated ears. Children with Noonan syndrome may also have a short stature. This is often due to slow growth during childhood. Heart defects are also common in Noonan syndrome. The most frequent heart problem is a thickening of the heart muscle, known as hypertrophic cardiomyopathy. Other features can include a webbed neck, chest deformities, bleeding problems, and developmental delays. It's important to remember that not everyone with Noonan syndrome will have all of these features. Additionally, the severity of these features can vary greatly from person to person. Section 4. Diagnosis and management of Noonan syndrome. Diagnosing Noonan syndrome usually begins with a physical exam. Doctors will look for the characteristic facial features, heart murmurs, and other physical signs. If Noonan syndrome is suspected, genetic testing can confirm the diagnosis. Genetic testing looks for mutations in the genes associated with Noonan syndrome. There's no cure for Noonan syndrome, but early intervention can make a big difference. Treatment focuses on managing the symptoms and preventing complications. This often involves a team of specialists. Cardiologists monitor and treat heart problems. Endocrinologists manage growth issues. Developmental pediatricians address learning and developmental delays. Section 5. Living with Noonan syndrome, support and outlook. Living with Noonan syndrome presents unique challenges. Early intervention and ongoing support are key to helping individuals thrive. Support groups and online communities connect families. They provide emotional support and practical advice. Genetic counseling is crucial for families. Counselors explain the inheritance pattern. They discuss the chances of having another child with the syndrome. The long-term outlook for people with Noonan syndrome varies. Most individuals live long and fulfilling lives. Early diagnosis and proactive management are crucial. With the right care and support, individuals with Noonan syndrome can overcome challenges and reach their